The distal radius is the main bone of the wrist, and a break here is the most common fracture of the upper limb. It usually happens from a fall onto an outstretched hand, whether a slip from standing height or a higher energy injury like a fall from a bike. The wrist becomes painful, swollen, and sometimes visibly out of shape. In younger people, it usually takes a bigger impact, while in older people it can happen from a simple fall, and may be the first sign of thinning bones. An X-ray confirms the break, and shows whether the pieces have shifted. Whether a broken wrist needs surgery depends mainly on whether the pieces are out of position, and whether they stay put. Stable, well-aligned fractures heal in a molded cast over 4 to 6 weeks, with X-rays along the way to check the position holds. If the wrist is badly out of shape at the start, it is usually straightened early with the area numbed. Surgery is offered when the break is displaced or unstable, when it extends into the joint surface, or when getting moving earlier matters. In older patients, a bone density check is often arranged afterwards because treating thinning bones helps prevent the next fracture. The operation fixes the break with a low-profile metal plate and screws, placed through an incision on the front of the wrist. The pieces are realigned, and the plate holds them in position while the bone heals, with X-ray imaging in theatre confirming the position. The operation usually takes around 60 to 90 minutes, under a regional or general anaesthetic, as a day or overnight stay. The plate sits deep under the muscle and usually stays in for good, without you noticing it. The aim is a wrist that heals straight and gets moving sooner. A removable splint protects the wrist for around 2 weeks, and gentle movement starts early, guided by a hand therapist. Light desk work usually resumes at around 2 weeks. Driving waits until you're out of the splint, and can control the wheel safely, typically 4 to 6 weeks. Heavier lifting and manual work are held off until around 12 weeks, when an X-ray usually confirms the bone has fully joined. Getting moving early is the rule after this kind of fixation, and most wrists regain very useful movement and strength over the following months.